Listen, everybody, we're now on to compassionate leadership. This takes us up to the break. We're going to have a little break at 11:10. So this is about a 45-minute whisk through this topic of compassionate leadership that's become a bit de rigueur of late in terms of the attention that's focused upon it. I'm going to try to give you a slightly potted version from our normal power hour session on this. We're going to do a 45-minute session on compassionate leadership. And please, this is designed as an interactive session, so feel free to put your hand up, unmute, and we can ask questions, seek clarification at any one point that we may choose to. I'm going to go straight to a sharing screen situation. So please enjoy, sit back, and here we go, everybody. Well, I thought the first thing we might want to do is just say to ourselves, well, what do we mean by compassion? Would anybody like to have a go at this? How do we define it? Why on earth are we all so interested in this? And I thought what might be worth doing is just looking at a couple of artworks, actually, that I decided might be useful to us. So the first one is by a Japanese artist called Muragaya. It was developed by Muragaya with an organization called the Compass Collective, and it was exhibited at the South Bank Centre in 2023. You can see both the characters there are actually famous flowers from Japanese mythology and storytelling. So one of them is a hyacinth flower. I'm not absolutely certain what the other one is, but doubtless somebody who's up on their Japanese flora and fauna will be able to help me. Anybody like to speculate what the Compass Collective is? Anybody heard of them? I'm quite happy to help if not. Okay, so the Compass Collective, it's a group designed and formed by and for child refugees who are coming into our country seeking refuge. And it's really from them that this theme of compassion that Muragaya then took and created was born. And you can see for them, it means about caring. It means unconditioned. It means just this thought of looking after one another. It's this business of demonstrating a concern for each other and kind of helping in a genuine sense people to overcome whatever obstacles or emotions they may be having to endure. I just think it's a lovely piece, and it's huge, by the way. If you did get to go and see it in the South Bank Centre, it's absolutely enormous. What about this one? This is from the 14th century, so the 1300s, can you believe? Avalokiteshvara, Buddhist goddess of compassion. I didn't even know there was a Buddhist goddess of compassion until I came across this. This is displayed in the Philadelphia Gallery of Fine Art. And the reason I put this up is to say, yes, compassionate leadership might be all de rigueur right now in 2024, but the context of compassion has been around for centuries, millennia even. And I just love the fact that even in the 1300s, in Tibet, somebody, well, Avalokiteshvara was the Buddhist goddess of compassion, but somebody managed to craft this. Can you imagine crafting this in the 1300s? Look at it and say to yourself, first of all, imagine the inspiration for doing it, but then imagine the love and the heart and the effort that would have gone into constructing it. I think it's a really interesting idea that compassion has been known as a force for good in our society for millennia. But all of a sudden in 2024, we've decided from a leadership and management perspective, actually, it's really important. So allow me, if you don't mind, just to expand this theme in a little bit more detail. Here's why I think all of a sudden we're highlighting why compassion is important. So these are just some stats that I've assembled. They're perfectly publicly available. These are from the most recent NHS staff survey and patient surveys and so on. But the fact is, this is the result of a lack of compassion within the NHS workforce, driven, dare I say, by too many leaders and managers who don't understand the positive power of it. I think there's a good reason why we have 130,000 vacancies across the NHS landscape. I think it's something to do with an overall inconsistent approach to compassion in how we deal with people. Look at this, 44.8% of NHS staff report a work-related stress illness. Why are people getting stressed? Could it be that they're being led by people who are in positions of authority over them, but who don't understand the power of compassion, indeed the imperative of compassion, if they're to get the best out of people and make certain that people feel a certain sense of well-being? NHS staff leaver rate was 12.5% in the year to September 2022. 12.5%, that means that 12.5% of the workforce churns every year. 57% of NHS staff would recommend the NHS as a place to work. That means, in case you haven't worked it out yet, 43% of our staff would not recommend the NHS as a place to work. More than 4 in 10 of us don't feel the NHS is a recommended place to work. Why? Ask yourself, why is that? And why is it that only 62.9% of staff would recommend the NHS as a place to be cared for? These are damning statistics. It's I take no pleasure in putting this up. It just makes me feel heartbroken. But I hope I'm illustrating to you why this concept of compassion in leadership is so important to us. In what we've been doing recently at the Institute around this topic, we've been looking at a rather splendid book, and by a rather splendid guy actually, called Professor Michael West. And Michael's book is Compassionate Leadership. Michael works for the King's Fund. He's Emeritus Professor of all sorts of stuff. And he's really led the way in terms of compassionate leadership, working with our country hub in Wales, the Health Education Improvement Wales Network, to actually address this business of compassion in leadership and figure out means by which it can be formally introduced as a quality of leaders that we look to and we encourage within the NHS leadership workforce. Allow me, if you will, to take you through some of the key themes of Michael's approach to compassionate leadership. The number one thing he talks about is that we need to attend. Would anybody like to speculate what the heck we mean by this? What is attending? What's this about? Feel free, you put your hand up, you can just unmute and shout out. I really don't mind.
Being present.
Being present. Who's that? Was that? Oh, I'm just trying
Louise.
Louise.
Marsh.
Again, Louise. Fantastic. It is. It's about being present. Most importantly, Louise, it's about the leader understanding the imperative of making time in their daily working day to be present, to address their staff, to find time to speak to them, to find time to listen to them and be there for them so that they can express to you whatever is going on, good or bad, in their daily working lives. But the imperative here is that we need to make time for this as a habitual activity in our daily working lives. If we don't, I can promise you now, most of us are busy people. We'll find that the time that we would ordinarily want to spend attending and being present for our people evaporates, and we suddenly find that a fortnight, 3 weeks has gone by where we failed to be able to be in person present to address the people with whom we work. That is catastrophic in terms of their ability to feel that we're being compassionate enough to care about their well-being and allowing them to express themselves. All right, so that's the first. Who'd like to speculate what Michael's second of 4 key foundation elements to compassionate leadership might be? Come on, have a go. Have a go here. People wondering. Nobody's quite certain. All right, how about this? It's understanding is the next thing. So you've been present, you've attended. The next thing is that you've understood. And you're probably wondering, what the heck are these photographs all about that I've put on the screen right now? Well, you can see it says there's the Loganair aeroplane. They're only typically fairly small airlines, but Loganair is Scotland's national airline. And you can see that those ladies there are holding up a giant ticket saying Cardiff to Edinburgh. Allow me to tell you a quick story then. So last year, I had to travel on Loganair up from Cardiff to Edinburgh to work with the fabulous organisation that is NHS Education Scotland. And on arriving at Cardiff Airport, I boarded the plane. It's only small, as I say, very tiny, strapped myself in, and I was ready. And as I was strapped in, I noticed there's a group of 6 people then appeared, and they were all wearing red, immaculate red, beautiful red polo shirts with the Welsh fleur-de-lis over the left breast, and underneath the fleur-de-lis it said Wales Deaf Bowling Team 2023. Okay, so that, well, they look fabulous. And what I didn't realize, because of the nature in which they got on, but they were actually going up to Scotland on that flight so that they could take a match over the coming weekend against their counterparts in Scotland and in Ireland. It was a triumvirate tournament was about to take place. So we've all sat down, everybody's buckled in, we're about to set off, and the cabin attendant appeared and gave the cabin safety announcement. And when she'd finished, she walked to where the 6 bowlers from the Wales Deaf Bowling Team were, and she proceeded to sign the whole of the cabin safety announcement to them using British Sign Language. Isn't that just lovely? And I asked her, I said, that's just gorgeous. You could see it. The bowlers, by the way, were hugely appreciative of the fact that this had taken place. Why do you think I'm telling you this story? What's so interesting here from the concept of understanding? All right, you're all a little bit shy this morning. Allow me to elaborate then. What I did was I had a chat with the cabin attendant and I said, that was just lovely. Can you give me a little bit of background to it? I'm just curious. She said, well, yes, one of the other cabin attendants with Loganair, we meet up quite regularly as a group, you know, as a team and that kind of stuff, share stories, share ideas. And her sister has been profoundly deaf from birth. So she was obliged to learn British Sign Language all through her childhood. She's now perfect in it. And she brought up at a team meeting that wouldn't it be lovely, in order to reflect the inclusivity and diversity of approach that Loganair are proud to exhibit, if we all learnt as cabin crew how to BSL the cabin safety announcement. So for the last few months, we've actually all been learning that. And you won't believe this, but that was my first opportunity to properly use it today, because I saw on the passenger manifest that the deaf bowlers were coming on board. I understood, therefore, that they might need some help in understanding the cabin safety announcement. So that was my debut. Isn't that just gorgeous? That makes it even better for me. Do you understand what I mean about? So just being present doesn't do it. Once they've then started to divulge, we've an obligation to listen, and then we've an obligation to demonstrate that we've listened by clearly stating that we've understood. I can't think of a better way of demonstrating that we've understood by doing BSL to a group of Welsh deaf bowlers. What do you think? Lovely story, huh? Travel Loganair, by the way. Do you all want to know what your in-flight meal is on Loganair? Anybody like to speculate? On any Loganair flight, anywhere in the country, what's your in-flight meal? You ready? A Tunnock's caramel biscuit. They bring them round in a basket. I kid you not. You can do a big grab if you want to. You can have as many as you like. I took 6 one time, and I felt rather poorly when we landed because I ate the lot. Anyway, that's by the by. You get the idea. That's the number 2 key element. Number 3 key element of compassionate leadership, according to Michael West, here we are, empathizing. So yes, we've been in attendance. Yes, we've understood. The next key thing we need to do is to empathize. And I can't think of a better example of lack of empathy than the catastrophic interview that Emily Maitlis undertook with Prince Andrew and his tone deaf lack of empathy in regard the victims of the Jeffrey Epstein scandal. And well, I don't want to say too much more about that. You'll all have watched the interview if you'd felt like it. But do you understand what I mean about a lack of empathy there, and how that might manifest itself in turning people off from feeling that you have their best interests at heart? Okay, so that's the third key element from Professor Michael West's perspective. The fourth and final thing is helping. So we've attended, we've understood, we've empathized. None of that matters if we're not then in a position to offer real, genuine help to somebody who's seeking it. And I don't mind telling you quite a difficult story. Emma knows all about this from the Institute of Health and Social Care Management. But actually, in March this year, I had a really very unpleasant seizure. I was laid very low by it. That's me in hospital where I've been taken by ambulance. That's my eldest son gurning there because he'd seen fit to come and visit me. But it was a really horrible experience. It was horrible for me, but I was unconscious for most of it. It was particularly horrible for my wife, who was present when it occurred, and a great friend of mine. And you can see the great friend of mine there in the spectacles. This is Cowbridge Male Voice Choir. His name is Paul. I'm privileged to be chairman of Cowbridge Male Voice Choir. We have about 80 choristers, and Paul was with me the afternoon I had my seizure because we were practicing some of our repertoire songs. Okay, he was a huge help because he was the conduit between me and 999 services, who were fantastic at trying to make sure that I was safe and could come round. My wife was so beside herself with woe that she couldn't really speak properly. So Paul did all of the really difficult stuff with 999, telling them when I stopped breathing and that kind of stuff. The really interesting thing is Paul was a huge help that day. But the key element of it is what he said to me subsequently. And now he's kind of processed what happened and what he saw and what he experienced. He said to me the other day, he said, "Jon, I've got to say, this is going to sound really weird, but I felt really privileged to be there so that I could help." Isn't that extraordinary? He felt really privileged to be there. And I said, "That's just lovely, Paul." It brought a bit of a tear to my eye, to be quite honest with you. But the thing that I found most interesting was, and I suspect a lot of you who work in health and social care feel this acutely on a daily basis, you do feel a sense of privilege to be in a situation where you are helping people when they are typically at their most vulnerable. And it doesn't matter what role you perform, you are part of this network of help and support for people who need health and care in our country. Do you get the idea here? Is everybody okay with this? I'm just looking through here. I'm looking at Sue Henry's written some stuff here and so on. Brené Brown, that's all good stuff. Okay. And Tom loves Loganair. Well, of course he does. It's the greatest airline on the planet, in my opinion. But that's it from Michael West's 4 key elements of compassion. Would anybody like to comment at all about this before I move along? Get Michael's book, by the way, if you do get the opportunity. It's a super read, and we're developing all sorts of content about it. Anybody at all? Okay, because what I'm going to do now is I'm going to stop sharing. I'm going to come back into the room. I'm going to talk to you about why this business of compassionate leadership, in my opinion, is such an imperative if we're serious about high performance leadership. So those of you who've been on our high performance leadership courses and workshops will know the work that we refer to extensively of Professor Beverly Alamo Metcalf. Okay, and Professor Beverly, Emeritus Visiting Professor of Leadership Studies at Leeds University School of Business and elsewhere, including Henley Management College and elsewhere. And Beverly talks about what she refers to as follower needs. So Beverly's hypothesis based is that the Hollywood version of leadership, this idea that the really high performing effective leaders are kind of physically perfect imposing presence, have a bit of an aura about them, a bit of a glint in the eye. When they enter, rooms fall silent and so on. People gasp at the sight of them. Beverly says, all that, if you're lucky enough to have any of those facets, well, good for you. But please understand that from a follower's perspective, none of that stuff is of any importance. Instead, what's really important to followers, well, would anybody like to speculate what the number one, not by that, but by that, would anybody like to speculate what the number one follower need is, according to a lifetime's academic research by Professor Beverly Alamo Metcalf? You can pop it in the chat. You can put your hand up. I don't mind. We'll have a look. Come on, what's the number one follower need of anybody? It doesn't matter whether you're in health and social care or you're in some other sector. What's the number one follower need? So Natalia says, empathize. Okay, good start. Good start. Tom says to feel valued. Getting a bit closer there, Tom. Anybody else like to have a go? Kindness, says Katie. To be seen, says Joanna. So Joanna, I suspect you're reflecting on that attendance thing that Professor Michael West talks about. Feeling safe, says Dawn. That's getting close, Dawn. Okay, let me tell you, I'll help you all here. The number one follower need, according to Professor Beverly Alamo Metcalf, lifetime's academic research into this topic, is that an effective leader demonstrates a genuine concern for the people whom they are privileged to lead. I'll repeat that. The high-performance, highly effective leader demonstrates a genuine concern for the people that they are privileged to lead. Now, if Professor Beverly Alamo Metcalf highlights that as the number one follower need, as I say, not by that, but by an absolute country mile, why is it taking us so long to figure out that compassionate leadership is really at the absolute epicenter of what we need to do if we're to get the best out of people? Tom, you're right. Yes, it is akin to servant leadership. Absolutely it is. But in my opinion, it's this business, it's this authenticity, this sincerity, this genuine nature of being concerned for the people that we lead. And we do that, of course, by Professor Michael West stuff. Well, I'll just repeat it if I may. I'm going to go back to sharing the screen. Going back to this business of attending, understanding, empathizing and helping. They're the key elements. If you think about, if I'm going to demonstrate genuine concern for the people who work for me, I need to attend, I need to be able to understand, I need to empathize, and I must be able to offer some type of help. And if I do all of that, I'm likely to be demonstrating what Professor West has talked about. Okay? You're right, Maribel, it's sensitive leadership, but why is it so difficult for too many people in the NHS to understand that the old-fashioned tell, direct, instruct, do what I tell you, intimidating, target-driven, key performance indicators and so on, that somehow that should take precedence to this idea of sensitivity, concern, authenticity, empathizing and compassion? I just don't see why it's such a difficult topic. Well, I'm not necessarily being truthful there. I think I do understand why compassion gets short shrift with too many of our leaders. And the reason for that, well, why do you think? Come on, help me out here. Why do you think that compassion is too often given a short shrift? So Katie says, seen as weakness. I don't disagree with that. Anybody else? Anybody else? Why isn't compassion bang up there? Why do so many people, when we go around the country dealing with our high performance leadership workshops, why do so many people fail to understand that this is a critical element? Wrong people taking the post, Natalia, or maybe we're recruiting for the wrong things. Maybe we're recruiting based on people's CVs rather than on their character and values. Okay. Chris says command and control culture from NHS England. Don't disagree with that. I would say it's probably not just NHS England, actually. It's just one of these things where we've become overwhelmed with this idea of key performance indicators and targets and consequence if we don't do this kind of stuff. And we've lost sight of the fact that those KPIs are outcomes based on how our people are made to feel on a daily basis. And if they feel considered, cared for, empathized with, understood, and far more likely to come to work on a daily basis and want to give of their best. Tosin, you've got your hand up. Would you like to contribute?
Yes, and I totally agree with all the points raised in the chat. And based on personal experience in NHS, I think that there is a difference between a leader being skillful in what they do and having a leadership skills. I've come to realize that people get there or people are placed in leadership posts, but they don't have leadership skills. They actually lack leadership skills, no compassion, no empathy, like you've spoken about. But then when you look at what they do in terms of their job, they have skills for it. So it's really a major issue, and that's one thing that has led me to start a PhD in leadership. It's something we really need to look into. Thank you.
Thank you, Tosin, and lovely to have you with us. I'm so glad that you've managed to get enrolled on your PhD, and I know that you continue to work with NHS England. It's fantastic news.
Thank you, John. And I would like to speak to you about my experience in terms of lack of empathy and leadership in that area, maybe privately later on.
Love to do that. We'd be very happy to. There's a lot of other comments coming in here. Insecurity stemming from incompetence, egotistical states of oneself, overly authoritative leadership styles, legacy outdated leadership in positions of power, setting bad examples, whole load of stuff that many of you have, I suspect, have experienced for yourself. The key question that I want to pose to you all is, so what? So there we are. We've done what? 40 minutes on compassionate leadership. So what? You see, I'm going to make an appeal to each of you. I know from listening and observing how difficult it sometimes is for any of you to be seen to be practicing compassionate leadership. There'll be other people, some of them will be senior to you, who will regard that type of behavior exhibited by you as a weakness or inappropriate or not hard enough, not focusing on the KPIs and so on, and they will mark you down effectively as a result of it. But Tom, I think you're right. My appeal to you is reject any notion that this is a soft-centered kind of approach. This takes courage to do well. And it takes courage to look other people who have a different view of leadership, look them in the eye and say that you're going to stick to your guns and that you're going to do this in this way. All of the experience that I have accumulated over the last 40 years of all sorts of different management and leadership positions tells me that if I want to get the best out of people that work with me, I need to demonstrate a compassionate approach to them in all that I do. And I have to present myself as the solution, potential solution to any kind of problems or anxieties that they may have. And if we do that effectively, we will get the best out of people. And those KPIs, those outcome things will look after themselves, to be quite honest. In other words, we'll be successful just by homing in on this. But it has to start with all of you on this call today, deciding, taking a bit of a pledge, if you will, that actually you're going to embrace this way of working and you're going to be proud to be seen to be doing it like this on a daily working basis in the environment in which you work. So long as we can all agree to that and embrace that and say, yep, that's fine, then we're in business. Okay. Would anybody like to comment? We've got about 10 minutes before we're supposed to finish up. So would anybody like to comment or give their own worked experience perspective on this? I'd be very happy if you'd like to unmute. Put your hand up, please, and then unmute, and I will be perfectly happy to come to you. Yes, Anne, would you like to go ahead? Thank you very much for going first.
Thank you. I think in a compassionate organisation, you are going to have safer care because people feel better able to speak up about mistakes. And not just mistakes, share their views, give ideas. If they feel they're valued, they're not going to be scared. They're going to be ridiculed for suggesting change. So I think it makes for a better organisational learning and growth because people just feel safer and more able to speak.
100%, Anne. I think you're absolutely spot on. And I mean, obviously I've not been very well earlier this year. I am fine, by the way. Now it's all being looked after and managed, and I'm okay. But when I was on a neurological ward being checked out, it was horrible to see how many of the nursing staff on the ward, particularly during the night shift, no longer wear name badges. Mm. And you ask yourself, what the heck's going on there? And I spoke to a couple of three of them. I said, I'm a big believer in the Hello, My Name Is campaign that has been led so effectively. And I said to them, why aren't you wearing a name badge? And do you know what they said to me? They said, honestly, we fear we know we're in an amber staffing situation on the ward at the moment. We know we haven't got enough staff. We're fearful of patients and or their families identifying us by name, and they're blaming what they perceive to be a lack of care and compassion for them on a named individual, because they'll read your name and they'll put you in the frame on any complaint that they choose to make. Isn't that frightful?
It's really sad.
All that's occurring because for whatever reason, the leadership in that particular environment are not understanding that that's how their people are feeling. And this is, by the way, this is not unique to the place I was. I've been to plenty of other hospitals around the country recently, looked at this, talked to people about it, and it's becoming a widespread problem. Isn't that just frightful that people feel that fear? And by the way, the other bit, that the reason they don't wear the name badge is through a fear of being trolled on social media, identified on social media through their name badge, and then horrible things being said about them. Isn't that just awful, But again, it's symptomatic of people not being listened to, being afraid to speak of their anxieties and their fears, and therefore the end result is take their name badge off, and anybody who's been in the hospital environment knows how important it is to be able to address their carer by name. Anyway, let's move along. Don't want to depress everybody too much. Claire, would you like to contribute, please?
Yeah, hi. Thank you very much, John. Just very, very quickly, really extending from the point that you just said, it's also when you are a compassionate leader, it's a nicer place to be a leader from. It's more enjoyable. It's not nice. I mean, it's absolutely awful to hear those stories, of which unfortunately there are many, about people not wanting to wear name badges and things. But when you are in the point where you can say, well, actually, I'll take my name badge off, and actually develop a relationship with the person, they are less likely to be threatening to you, and you've had a nicer day because you've built those relationships. So it's a win-win situation, because not only are you working from a leadership perspective more effectively, but you have a better day, because a majority of people, if you're going around, being absolutely dogmatic all of the time, that's not a pleasant way to exist. It's not an enjoyable way to exist. Whereas actually, if you are developing empathy, understanding, all the things that you referred to today, it's just a nicer existence to be as a leader as well. And unfortunately, we've still got an outdated perception that a lot of people see leadership as actually you are detached, you have to become grimmer the higher up the chain you go. And so people think, well, unfortunately, I can't move amongst people and be pleasant and have a chat and develop those empathetic skills because people will think less of me as a leader. And it couldn't be further from the truth. So brilliant today, really, really enjoyed it. And it's just really important to say it's not all about other people, it's about what you also get out of it as a leader.
Yeah, I love that, Claire. Thank you very much. And P.S., those same people who are looking miserable around the place because they're they're not a compassionate leader. They're the people struggling with retention and recruitment as well. They're the people who are endlessly complaining about low staffing numbers and the fact that a whole heap of people have left. And in my experience, it's a truism, people leave managers, not jobs. In my experience, I've probably led thousands of people. I don't mean to be, I'm not trying to wave a particular flag there. I've just been lucky in my career. I've been lucky enough to lead thousands of people. And honestly, no more than 2 or 3 out of those thousands over the course of my career who I'd regard as deliberately coming to work to do a poor job. Most people come to work to give of their very best, and they just need a leader who's there to encourage, support, and inspire them and set them free, and they'll do it. They'll do it. Thank you very much, Claire. Chris, may I come to you? Thank you. Chris Davison, thank you.
Can you hear me okay?
We can, Chris, yes.
Hello, John. Hi. Thank you for the session today. And I'm really sorry to hear that you haven't been in the best of health earlier this year. That would have been a very worrying time for you and your loved ones. And I'm really pleased to see that you're well on the road to recovery.
Good as now.
Good man. Thank you for laying down that challenge, John. I think, like you, in my career, I've led a lot of teams and staff, particularly in acute trusts, with mainly surgical, medical, complex teams. I haven't got it right every time, but I think there is that balance around support, empathy, being present, attending, and working with the team by being credible and authentic, and then hitting the targets. I don't think the two are mutually exclusive, but thank you for laying that challenge. And I would encourage everyone on this call to just think how you could implement that one thing in that sphere of influence. There's a bigger cultural problem with the NHS, wherever you are around what's going on at the moment. But think of how we can respond to John's challenge by influencing just one area of your team without being present, being authentic, listening. I mean, it's very timely because in my present role, I head up a mental health charity, and I'm speaking next week to a conference on supporting our people, utilizing some of the Michael West principles, but also about taking time to listen, to attend, to authentic. And I just want to help. Yes, I was struggling.
You've got to demonstrate the help bit. Otherwise, the other 3 just in isolation doesn't work. You've also got to be seen to be a help. And if I may, Chris, this doesn't mean that you don't address underperformance.
No, that's right. We absolutely.
It's just about just being Mr. Nice Guy or Mrs. Nice Guy all of the time.
No,
it's just about demonstrating that you are prepared to listen, you're prepared to understand and empathize, and you're prepared to help. And typically, in my experience, if people are underperforming, then it's because either something is going on in their private lives that is upsetting them and causing a problem, or it's down to you because they haven't been given the skills and aptitudes and understanding to equip them to do what you're asking of them. So one way or another, you're not going to address any of that stuff if you're not attending, understanding, empathizing and helping. All of that still applies. So this is not about just being Mr. Softy effectively. This is about performance, and it's about creating an environment in which people can flourish and thrive. All right, thank you.
Thank you very much, John. Thank you.
To see you today as well. Thank you.
And you too. Cheers.
All right, look, I think we'll leave it there. I don't want to be coming across as pontificating too much. Tom says more than half the people who leave their role leave their manager, not the organisation. 100%. I think way more than half. I bet it's about 80 or 90%, to be quite honest, Tom. But look, we'll leave it there. We're going to have a little break now. The break lasts until 11:30, so you've got about 20, 25 minutes, something like that, to go and get yourself a cup of coffee and a hobnob, slice of toast, Mars bar, apple, banana. We should be promoting healthy eating today, I think. And for now, we'll let you go, and we'll see you again very shortly. As I say, we're starting again at 11:30. There's various different elements that you can be coming back to. I'll leave you to find those. Thank you very much, everybody. Bye-bye.